My name is Dr. Grey Leonard. I'm a surgical oncologist. I work for Premier Surgical Associates at the Fort Sanders location. As a surgical oncologist, I focus on mainly cancers of the abdomen. I treat hepatobiliary and pancreatic cancer, in addition to esophageal, gastric, and small bowel tumors. In addition, I treat adrenal masses and retroperitoneal sarcomas. My special focus would be hepatobiliary and pancreatic cancer, or HPV. Those are cancers of the liver, bile ducts, and the pancreas. I was a cadet at the Air Force Academy, and I graduated back in 2004. The cadets had values: integrity first, service before self, and excellence in all we do. And I've taken that with me through those years and my time in the Air Force to apply it to what I do, and I apply those values to my patient care now. I treat all my patients with integrity. I make sure that they are taken care of, and the care that I provide for them, I feel, is done at the highest level. The military heritage runs deep in my family. Both my grandfathers served in World War II, Marines and Navy. My father was Army, and he flew attack helicopters in Vietnam. And my brother just retired as a 2-star. Well, you may ask why I'm not flying planes right now, and that's because shortly after I graduated from the academy, I was diagnosed with Crohn's disease and was given a medical discharge. I had to make a change in my life's path, and I chose medicine. And I did that because I was able to shadow a general surgeon in the small town where I was stationed. And I was amazed at what he was able to do for his patients, and how he was able to take care of their surgical problem, take care of them afterwards, and counsel them through the whole disease process. And I was blown away by what he was able to do, and I wanted to do that. I met my wife. We got married 1 week before starting medical school at Morsani College of Medicine in Tampa, Florida. From there, we moved out to Texas to complete general surgery residency at UT Southwestern. Upon graduation, I went to complete a complex surgical oncology fellowship at Wake Forest University in Winston-Salem, North Carolina. And now I found myself over the mountains a little bit further west. It's complicated, and it involves many different types of therapies. It involves surgical expertise, and it's something that I just enjoy doing. I love surgery, and I feel like that is what I've been called to do, and I feel like it's the best way that I can help patients. I'm sort of the quarterback on the team of care, and working with the different specialists, calling the plays, but looking at the big picture. I want to be able to treat them well in the operating room, get them through the procedure well, and then see them along for the full comprehensive care that they require. We have always been somewhat in the Southeast, and we really much enjoy the culture and the weather. And this was a great job. I had the opportunity to come here and work with Dr. Midas, who's my senior partner, and to learn from him, and to work with the rest of my partners, who are all wonderful people. And I think it's a rare thing to find a group of surgeons working in private practice that treat each other so well and work together as a team. I have 4 children and 1 on the way, and so that's going to be very exciting to take care of. We love children, obviously. One of the things that I like to do is when I'm able to get home is to get all the kids out in the garage and work out with my son. And I have been building up a nice home gym, trying to raise strong kids and give mommy some time to decompress a little bit before we all have dinner. I like to be able to help them through the whole process because it's a difficult and oftentimes a very long one. And I feel like the surgeries can oftentimes be technically demanding, and I feel like I can provide them with that expert care.